Well, it's time for our health report, and joining us now is Africa 54 health correspondent Linord Moudou with the latest news on the fight against the HIV virus. Hello, Linord.
The humanitarian aid group Doctors Without Borders says worldwide goals to curb HIV infection by 2020 will not be met unless aid providers recognize and meet the need for more work in West and Central Africa. In a recently released report, MSF says while HIV prevalence in that region is relatively low, with 2.3% of the population living with the virus, it is still 3 times the worldwide rate, and pockets of that region have prevalence rates as high as 5%. The report urges global donor agencies, governments, and civil society to fast-track a plan to scale up antiretroviral treatment for countries in the region where less than 1/3 of the population in need is currently getting treatment. Now, the United Nations Children's Agency is testing drones in Malawi to see if they can reduce waiting times for HIV test results in rural areas. The first successful flight completed a 10-kilometer route, traveling from a community health center to a hospital in Malawi's capital, Lilongwe. Poor roads and lack of transportation make it hard for mothers in remote areas of Malawi to get to labs capable of testing. Judith Sherman is the head of UNICEF Malawi's HIV and AIDS program.
There are many delays in the continuum of getting HIV-positive children on treatment. They need to come in early for testing, ideally before 2 months, between 6 and 8 weeks. Their tests, the dried blood spots, need to get from the health facilities to one of the 8 laboratories nationwide.
Currently, it can take almost 2 months to get samples from a healthcare facility to a laboratory and for the results to be returned. Motorbike couriers are used to transport samples across often poorly maintained roads.
It's a very painful experience for me because as it is, I don't know whether my child got the disease from me or if he's okay, so the waiting is painful.
The UN Children's Agency has partnered with US-based drone company Martinet to develop the program. Testing is currently conducted using simulated samples. UNICEF says every year around 10,000 children die of the virus, a number the agency says could be tackled by early diagnosis and quality medical care. Now to Uganda. The country has made remarkable progress in respect to addressing the epidemic, but experts worry that numbers of those living with HIV are surging again. Africa 54's Paul Ndiho has our report.
The United Nations says an estimated 34 million people worldwide are living with HIV, and some 30 million people across the globe have died from AIDS-related causes. Sub-Saharan Africa accounts for almost 70% of the global total of new infections. Sheila Birungi Gandhi, Acting Executive Director of the Uganda AIDS Information Center, a non-governmental organization, says her organization continues to play a critical role.
We started with basically laboratory services where we're testing for HIV and providing services. But given the trend of HIV in the country, we progressed into an HIV comprehensive healthcare center.
Since the early 90s, Uganda has been hailed by many as a success story in addressing the HIV/AIDS epidemic, compared to most sub-Saharan African countries. However, critics say that recent AIDS indicators show the country is sliding back into double digits. But Ms. Gandhi dismisses those claims.
We have interventions that help us to prevent HIV, like testing for HIV and AIDS, screening cancer of the cervix, taking males through safe male circumcision, and lots of treatment and care support services with the medical background, the medical interventions.
Analysts say for Uganda, the stakes could not be higher. Marion Natkunda is an advocacy and research manager for the Uganda AIDS Information Center.
Without knowing HIV status, there's no way you're going to actually know whether you're okay or you're not okay. So know your HIV status and let's take it up from there. So us went and camped each and everywhere, wherever we're called upon. even at City Square, even at a bar, even at a lodge, even at the streets. Yeah, we had what they call moonlight testing. Yeah, we would go extremes just to make sure at least a Ugandan knows their HIV status.
During his landmark visit to Africa last year, U.S. President Barack Obama highlighted Africa's achievement in health.
Africa has achieved historic gains in health. The rate of new HIV/AIDS infections has plummeted. African mothers are more likely to survive childbirth and have healthy babies. Deaths from malaria have been slashed, saving the lives of millions of African children.
In July, the 21st AIDS conference will be held in Durban, South Africa. The campaign dubbed AIDS 26 is an opportunity to showcase the progress Africa has made in implementing and funding evidence-based prevention and treatment interventions. Scientists, policymakers, world leaders, and HIV patients will discuss together successes and challenges to the country and the current global epidemic trend. Paul Ndiho, VOA News.
That's our health report for today. To stay in touch for more health news, find me on Twitter at Linord Moudou. Vincent?
Well, thanks a lot, Linord. Now be sure to watch Linord Moudou's health reports every Tuesday and Thursday right here on Africa 54.